It's Wednesday, October 13, and this is your midweek Barbados Today Evening News Update. Current public health measures are not enough to arrest the fast-spreading coronavirus outbreak being fueled by the Delta variant. So cautions the University of the West Indies epidemiologist, Dr. Natasha Sobers-Granum. She told today's COVID-19 update that without more restrictions, daily cases could more than double.
We're now thinking closer to 700-800, but that's again worst case. And I also want to make the point that worst case is, as I said earlier, is not something that we want to see. It is putting the numbers out there so that people can put the public health measures in place so that we don't reach them. So the 700-800 is not a target, it's a prevention method. This is where we do not need to go. We need to do what we need to do so we do not get any worse than what it is now. I don't think that we will see those numbers, or I don't think we're going to see those numbers reported. Remember, we're not going to be seeing those numbers actually reported. Those are the numbers that would be, so we might report maybe as much as 400 in the actual reported cases. We have to remember that that's an underestimate of what's happening in the community.
Dr. Sobers-Granum made it clear that while a national shutdown could do more harm than good at this stage, she believes reduced movement and other measures proposed by the Association of Medical Practitioners could help to flatten the curve.
The measures that are in place have not so far slowed down the pandemic. So I would very much be in alignment with BAP and BAP's recommendations that say that we should have movement days and a little bit more restrictions that we have. BAP has already said that places like bars should have smaller numbers, places of worship should have smaller numbers. So I would say yes, that the restrictions that we have in place are not sufficient to slow it down. But I will also recognize that the movement restrictions have, because I'm a doctor, I'm going to say side effects. And so it has other effects that we might not want, some economic effects, but also NCD effects that Dr. Herbert spoke about. So we recognize that full, lockdown like what we had before is not likely to be, it's not likely to have the effect that it did before, and it's likely to have some negative effects that we don't want, side effects that we don't want.
The COVID-19 death toll moved to 106 today as 3 more Barbadians succumbed to the viral illness. This morning, a 49-year-old man who was fully vaccinated passed away after spending 5 days in isolation at Harrison Point. The other 2 patients died this afternoon. A 50-year-old woman passed away while in primary isolation at Harrison Point, and a 73-year-old died in the Accident and Emergency Department at the Queen Elizabeth Hospital. They were both unvaccinated. Meanwhile, 311 new COVID-19 cases were confirmed from the 2,473 tests conducted by the Barbados Santos Public Health Laboratory. Of the 155 females and 156 males who tested positive, 69 persons were under the age of 18 and 242 were 18 years and older. There are 541 people in isolation facilities and 2,273 in home isolation. In just 10 days, the number of persons in home isolation across the country has almost quadrupled. Word of this from Consultant Manager of Home Quarantine and member of the Isolation and Quarantine Committee, Dr. Adana Grandison, who told today's press briefing that if the spike in COVID-19 cases continue, the program will become overwhelmed.
Have had that discussion in terms of what happens when we get to X amount of persons in community, where again, the physical human resource is now being overwhelmed in terms of being able to meet the expectations of persons. Now, we know that internationally, there are some countries that persons who are safe, they don't even get a call back during their period of isolation, right? They're just monitored, they're kept there. If they have to, for instance, have a change in status, they make the call, they notify personnel, and it's only when they become symptomatic and they're having challenges that they reach out. We still want to give that very personal touch where persons can be able to communicate with the healthcare professional to know what is happening. But we are starting to look at that, because if the projections are right, we know that we are going to have a lot more persons in home isolation and potentially a lot more persons getting ill.
Despite the increase in numbers, Dr. Grandison disclosed there have been no deaths among patients in the home isolation program.
We have not had any reported deaths of persons who have entered the program. So there are persons who have died at home who did not even have for instance, know their status. And that's why we ask persons to get out and really know your status. I see Dr. Sobers Granum. She made a really good point that there are reported deaths, which are persons who have presented and have been tested and know their status. And then there are persons who are actually walking around that don't know their status, but they cannot be added to the total number of persons in community that are positive, but they're out there. And so we have had some persons who had not been tested in what we call the ante-mortem phase or prior to death, and they did not know their status, and upon death, they were tested and were known to be positive. And these persons would have been living at home like normal. So they're not part of the home isolation program, but they are persons who died at home.
A family physician today expressed concern that there will be long-term effects on the healthcare system as the COVID-19 pandemic drags on. Speaking at today's press briefing, Dr. Joseph Herbert said with medical specialists heavily focused on fighting the pandemic, the attention being paid to common health issues like the management of chronic diseases is dwindling.
Patients are sometimes scared to seek care because what if I'm exposed to COVID-19 by going in a waiting room? What if the healthcare system is so overburdened that I have to wait so long? What if something happens there? And so we have to think of it in basically two main ways. One, in that people are not able to access care in the same way that they were pre-pandemic, and that means that particularly for urgent and emergent situations that they're not as easily getting hold of that care, and the healthcare system under strain means that our specialists are sort of diluted. They're not all in the place where they need to be. And in the long term, the inability to control your chronic diseases as well and to maintain healthy lifestyle is making it such that we expect less controlled chronic diseases, and prevention that is not being done as well means that we expect to see over the coming years an increase in the consequence of those things, and what we're seeing is we have to plan for that and do whatever we can to nip that in the bud and address it as best as we can given the limitations that we have.
Director of the Pan American Health Organization, Dr. Cursetta Etienne, says while COVID-19 infections have generally declined in the Americas in the past week, local trends remain worrisome. Speaking at the weekly PAHO press briefing today, Dr. Etienne called on countries to expedite vaccination efforts and take steps to strengthen surveillance efforts.
But we are seeing some spikes at the subnational level. For instance, cases are up in the greater Caracas area, Venezuela, and in parts of Chile's southernmost regions. In the Caribbean, Barbados is reporting the highest number of COVID cases and deaths since the pandemic started, following a five-fold increase in COVID infections over the last month. Cases have also increased in the Dominican Republic, Haiti, and smaller islands like the Cayman Islands, Antigua and Barbuda, and Anguilla. So we continue to urge countries to keep a close eye on how the virus is spreading locally so they can focus on controlling these outbreaks. Public health measures remain critical to control the spread of COVID everywhere, especially as vaccine supply remains limited.
There's regional and international news after this short break.
Hi, my name is Michelle Thompson. I'm a visually impaired person. I am also a member of the National United Society of the Blind of Barbados. I am vaccinated. I took the vaccination due to the fact that I am diabetic, I'm asthmatic, and I also have high blood pressure. I had no side effects. Everything went calm and smooth, as my doctor said it would go. Please, people, go ahead and do the right thing.
Let's roll up our sleeves and get back to living.
To regional happenings in Antigua and Barbuda, Prime Minister Gaston Brown has revealed that 70% of the total population could be vaccinated in 30 days. We get the details from Antigua Newsroom.
About 70% of the 80% that we need to achieve to get to herd immunity vaccinated, and about 60% are fully vaccinated. So we do have a large category of persons who are, fully vaccinated or would have had their first dose. So we get in there, and based on the amount of individuals who would have had at least their first vaccination, I can see us get into probably about 70% of the total population within the next 30 days. So if provided, the momentum continues, and unfortunately, we may see some reduction because of the unavailability of some of the vaccine types at this time. But we hope that within the next week or two, when we get in some additional Pfizer vaccines, that we should be able to see a continued momentum.
On the international front, U.S. President Joe Biden launched an effort to ease supply chain blockages that are threatening to disrupt the U.S. holiday season. The plan includes relying on expanded round-the-clock port and shipping operations. More in this report from Reuters TV.
After weeks of negotiation and working with my team and with the major union retailers and freight movers, the Port of Los Angeles announced today that it's going to begin operating 24 hours a day, 7 days a week. This follows the Port of Long Beach's commitment to 24/7 that it announced just weeks ago. So by increasing the number of late-night hours of operation and opening up for less crowded hours when the goods can move faster, today's announcement has the potential to be a game changer. I say potential because all of these goods won't move by themselves. We need major retailers who order the goods and the freight movers who take the goods from the ships to factories and to stores to step up as well.
That's news, but for the very latest, you can visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as Screenplay at supermarkets and gas stations near you. You can also hear us on Capital Media HD 99.3 FM.